So, good day, ma'am. My report is the continuation of the subsequent physical assessment of newborn and infants. And the assessment procedure is inspection and palpation of hair for the infants. Observe for distribution, characteristics, and presence of any unusual hair in the body. So, in the normal findings, hair is normally lustrous, silky, strong, and elastic. Lonogofine, downy hair that covers parts of the body such as the shoulders, back, and sacral area may be seen in the newborn or young infant. So those are the normal findings in assessing the hair of young infants. But there are cultural considerations. African American children usually have hair that is curlier and coarser than Caucasian children. And the abnormal findings are dirty, matted hair may indicate neglect, tufts of hair over spine may indicate spina bifida occulta. And the next assessment procedure is the inspection and palpation of nails. So in doing the inspection and palpation of the nails, it's include the color, the texture, shape, and condition of nails. So there are also cultural considerations in the normal findings for the nails. Dark-skinned children have deeper nail pigment. Nails extend to and fingers or beyond and are well formed. But the abnormal findings on assessing the nails: blue nail beds indicate cyanosis. Yellow nail beds indicate jaundice. Blue-black nail beds suggest a nail bed hemorrhage. So the next is the assessment of head, neck, and cervical lymph nodes of infants. So inspection and palpation of the head. So inspection and palpation of the head. So it should be included the shape and symmetry. In newborns, inspection and palpation the sutures and fontanelles are included. So head is normocephalic and symmetric. In newborns, the head may be oddly shaped from molding, overriding of the sutures during vaginal birth because the head of the babies are so soft. The diamond-shaped anterior fontanelle measures about 4.5 centimeters and is wide. And the diamond-shaped anterior fontanelle measures about 4 to 5 centimeters and its widest part. It usually closes by 12 to 18 months. The triangular posterior fontanelle measures about 0.5 to 1 centimeter and its widest part and should close at 12 months, 2 months age. And the abnormal findings of inspection and palpation of the head is a very large head is found with hydrocephalus, and an oddly shaped head is found with premature closure and of sutures, possibly genetic. One-sided flattening of the head suggests prolonged positioning on one side, and a third fontanelle between the anterior and the posterior fontanelle is seen with Down syndrome. Premature closures of sutures, craniosynostosis may result in capocicidium, and bulging fontanelle indicates increased cranial pressure. Microcephaly is seen with infants who have been exposed to congenital infections. So those are the abnormal findings on inspecting and palpating the head of infants. So next is the assessment procedure or the test, head control, head posture, and ROM. So normal findings. So full rotation of the head of the infants up and down sideways, it's normal. And infants should have head control by 4 months of age. So when the infants reach at the 4 months of age, so they have the control of their head and upside down or sideways. And the abnormal findings are hypertension is seen with opisthotonus or significant meningeal irritation, and limited range of motion may indicate torticollis or Raynaud. And next is the inspection and palpation of the face. And inspecting and palpation of the face, so it should be included appearance, the symmetry, and movement. And palpate the parotid glands for swelling. And the normal findings, face is normally proportionate and symmetric, so they're on the same size and symmetric to the other side. Movements are equal bilaterally. Parotid glands are normal size, and there is also abnormal findings in inspecting and palpating. So the abnormal findings of inspecting and palpating the face: unusual proportions, short parapebral fissures, thin lips, and white and flat philtrum, which is the groove above the upper lip, may be hereditary or they may indicate specific syndromes such as Down syndrome and fetal alcohol syndrome. Unequal movement may indicate facial nerve paralysis, and abnormal faces may indicate chromosomal anomaly. So, next in the assessment procedure is inspection and palpation of the neck. Palpate the thyroid gland and trachea. Also inspect and palpate the cervical lymph nodes for swelling, mobility, temperature, and tenderness. So there's also a clinical tip. The thyroid is very difficult to palpate in an infant because of the short, thick neck. So we can all relate that babies have small, short, and thick neck. So the normal findings and inspection and palpation of the neck is that the neck is usually short with skin folds between the head and shoulder during the infancy. The isthmus is the only portion of the thyroid that should be palpable. The trachea is in the midline, and lymph nodes are usually non-palpable in infants. So clavicles are symmetrical and intact, and the inspection and palpation of the neck are also abnormal findings. Implication of some abnormal findings include the following. So short weave neck suggests anomalies or syndromes such as Down syndrome. The other one is distended neck veins may indicate difficulty breathing. The third one, enlarged thyroid or palpable masses suggests a pathologic process. The fourth one and the other one is shape and tracheal position from midline suggests a serious lung problem. Example is the foreign body or tumor. So, and the last one is the creplus when clavicle palpated along with the decreased movement in arm of that sideway may indicate fractured clavicle. And next in the assessment procedure is the inspection of the external eye. Then inspecting the external eye, it should be included the position, slant, and epicanthal folds of the external eye. So next is the normal findings of inspecting the external eye. So inner canthus distance approximately 2.5 cm. Horizontal slant, no epicanthal folds. Outer canthus aligns with tips of penis. So that is the normal findings of inspecting the external eye. So there is also cultural considerations. Epicanthal in the epicanthal folds, excess of skin extending from roof of nose that partially or completely covers the inner canthus are normal findings in Asian children whose eyes also slant upward. So that is the cultural considerations. And the other one is the abnormal findings of inspecting the external eye. Wide set position, the hypertelorism, upward slant, and thick epicanthal fold suggests Down syndrome. The sunsetting appearance is upper lid covers part of the iris suggests hydrocephalus. And the next in assessing the eyes is observe the next assessment procedure in the eyes is observe eyelid placement, swelling, discharge, and lesions. So the normal findings: eyelids have transient edema, absence of tears. And next is the abnormal findings: eyelids inflammation may result from infection, swelling, erythema, or purulent discharge may indicate infection or black tear ducts. And the other one is the purulent discharge seen with sexually transmitted infections. It's maybe gonorrhea or chlamydia. And the other is the inspecting the sclera and conjunctiva for color, discharge lesions, redness, and lacerations of the eyes. Sclera and conjunctiva are clear and free of discharge lesions, redness, or lacerations. Small subconjunctival hemorrhages may be seen in newborns. So the abnormal so that is the normal findings. So the abnormal findings is yellow sclera suggests jaundice, blue sclera may indicate osteogenesis imperfecta or the brittle bone disease. So now ma'am, the next assessment procedure is observing the iris and the pupils. So in normal findings, typically the iris is blue in light-skinned infants and brown in dark-skinned infants. Permanent color develops within 9 months. And Brushfield spots can be observed white flakes on the periphery of the iris and may be normal in some infants. Pupils are equal, round, and reactive to light and accommodation. So, in short, it's called perla. And the abnormal findings: Brushfield spots may indicate Down syndrome. Sluggish pupils indicates neurologic problem. The meiosis or the constriction indicates iritis or narcotic use or abuse. And mydriasis is the pupillary dilation, indicates emotional factors, fear, trauma, or certain drug use. And the next assessment procedure is inspect the eyebrows and eyelashes. So the normal findings: eyebrows should be symmetric in shape and movement. They should not meet midline, and eyelashes should be evenly distributed and curled outward. And the abnormal findings is only sparseness of eyebrows or lashes could indicate skin disease. So the next assessment procedure is that the performing visual acuity test. So assess visual acuity by observing infants to gaze to an object. So the normal findings is visual acuity is difficult to test in infants. Test by observing the infant's ability to fix on and follow objects. So normal visual acuity is as follows. So in birth, 20/100 to 20/400. So in 1 year, 20/200. So by 4 weeks of age, the infant should be able to fixate on objects. By 6 to 8 weeks, eyes should follow a moving object. So by 3 months, the infant is able to follow and reach for an object. So the abnormal findings and performing visual acuity test: children with one line difference between eyes should be referred to for an ophthalmology exam. So the next assessment procedure is that performing ophthalmoscopic examination. The procedure is the same as for adults. Distraction is preferred over the use of restraint, which is likely to result in crying and closed eyes. And careful ophthalmoscopic examination of newborns is difficult without the use of myalgic medications. So now ma'am, next is the normal findings on performing ophthalmoscopic examination. So, red reflex is present. This reflex rules out most serious defects of the cornea. So, aqueous chamber lens and vitreous humor when visualized. The optic disc appears similar to an adult's. Newborn's optic discs are pale, peripheral vessels are not well developed, and the abnormal findings is the absence of the red reflex indicate cataracts, or in Tagalog is catarata, and papilledema is unusual in children of this age owing to the ability of the fontanelles and sutures to open during increased intracranial pressure. So this blurring and hemorrhage should be reported immediately. And the other one is abnormal findings include congenital defects such as cataracts or the catarata. Or and the next assessment procedure for the infants is the ears. So inspect the external ears. So in inspecting the external ears is includes the placement, discharge, or lesions of the ear. So the normal findings, top of pinna should cross the eye occiput line and be within a 10-degree angle of a perpendicular line drawn from the eye occiput line to the lobe. No unusual structure or marking should appear on the pinna. So, the abnormal findings, low set ears with an alignment greater than a 10-degree angle. So, in the figure 10 to 8, page 716, so it was suggest retardation or congenital syndromes. Abnormal shape may suggest renal disease process, which may hereditary, and preauricular skin tags or cyanosis suggest other anomalies of the ears of renal system. So now ma'am is the next is the assessment procedure of inspecting the internal ear. So the internal ear examination requires an otoscope. The nurse should always hold the otoscope in a manner that allows for rapid removal if the child moves. Then have the caregiver hold and restrain the child because an infant's external canal is short and straight. Pull the pinna down and back. And the normal findings and inspection internal ear. There is no excessive cerumen, discharge, lesions, excoriations, or foreign body and external canal. And the other normal findings is amniotic fluid or the vernix may be present in canal of the ear of the newborn. And the other one is the tympanic membrane is fairly gray to light pink with normal landmarks. Tympanic membranes ridden bilaterally with when child is crying or febrile. And the abnormal findings, presence of bodies or cerumen impaction. Purulent discharge may indicate otitis externa or presence of foreign body. Purulent serous discharge suggests otitis media, and bloody discharge suggests trauma, and clear discharge may indicate cerebrospinal fluid leak, and perforated tympanic membrane may also be noted. And next is the call that now ma'am is next of the assessment procedure is assess the mobility of the tympanic membrane by pneumatic otoscopy. This consists of creating pressure against the tympanic membrane using air. To do this, create a seal in the external canal and direct a puff of air against the tympanic membrane. So, in assessing the mobility of the tympanic membrane, the normal findings is tympanic membrane is mobile, moves inward with positive pressure when squeeze of bulb, and outward with negative pressure or when releasing the bulb. So the abnormal findings is immobility indicates fluid behind tympanic membrane. So next is the hearing acuity. So in the infant, test hearing acuity by noticing the reaction to nose. Stand approximately 12 inches from the infant and create a loud noise. Example is the clap hands, shake, squeeze a noisy toy. And the normal findings is a newborn will exhibit the startle or moro or the moro reflex and blink eyes or the acoustic blink reflex in response to noise. Older infant will turn head. So in the abnormal findings, so no reactions to noise may indicate hearing deficit. Audiometry results outside. And the next assessment procedure in infants, mom, is done in mouth, throat, nose, and sinuses. So first one is inspect mouth and throat. So in inspecting the mouth and throat, condition of the lips, palates, tongue, and buccal mucosa are included. So the normal findings: Epstein pearls, small yellow-white retention cysts on the hard palate and gums are common in newborns and usually disappear in the first weeks of life. So in infants, a sucking tubercle or the pad from the friction of sucking may be evident in the middle of the upper lip. And the abnormal findings: white discharge noted on the tongue or buccal mucosa is thrush. Cleft lip and or a palate are congenital abnormalities. And next, ma'am, is observe the condition of the gums. When teeth appear, count teeth and include the location. So the normal findings: gums appear pink and moist. Teeth may begin erupting at 4 to 6 months. Teeth develop in sequential order by 10 months. Most infants have two upper and two lower central incisors. So the abnormal findings is only abnormal findings include lesion and edema. And the next assessment procedure is the condition of the throat and tonsils. Also observe the insertion and ending point of the frenulum. So the normal findings: tonsils are not visible in newborns. As the infant gets older, it is possible but still difficult to see tonsils. And the abnormal findings: extension of the frenulum to the tip of tongue may interfere with extension of the tongue, which causes speech difficulties. So the next assessment procedure is inspect nose and sinuses. So to inspect the nose and sinuses, avoid using the nasal speculum in infants and young children. Instead, push up the tip of the nose and shine the light into each nostril. And observe the structure and patency of the nares at the nares. Discharge, tenderness, and any color or swelling of the turbinates. So the normal findings: nose is midline in face, septum is straight, and nares are patent. No discharge or tenderness is present. Turbinates are pink and free of edema. Milia are small white papules found in the nose, forehead, and chin. And they develop from retention of sebum in sebaceous pores. They usually resolve spontaneously within a few weeks. And the abnormal findings: conal atresia is blockage of the posterior nares in the newborn. And if the blockage is bilateral, the newborn is at risk for acute respiratory distress, and immediate referral is necessary. Deviated septum may be congenital or caused by injury, and foul discharge from one nostril may indicate a foreign body. And next, there's also a clinical tip that infants are obligatory nose breathers. Consequently, obstructed nasal passages may precipitate serious health conditions, making it very important to assess the patency of the nares in the newborn. If after sanctioning fluid and mucus from the nares, You suspect obstruction, insert a small lumen catheter into each nostril to assess patency. So the next part of the body, the next part of infants to assess is the thorax. So assessment procedure of thorax is inspect the shape of the thorax and normal findings. Infant's thorax is smooth, rounded, and symmetric. So the abnormal findings is the thorax is in abnormal shape, includes pictus excavatum and pictus carinatum. And the other is observing respiratory effort, keeping in mind that newborns and young infants are obligatory nose breathers. So respiration should be unlabored and regular in all ages except for immediate newborn period when respirations are irregular. So some newborns, especially the premature, have periodic irregular breathing, sometimes with apnea. So apnea is the episode when breathing stops, so lasting a few seconds. This is a normal finding if bradycardia does not accompany irregular breathing. So the other abnormal findings is distractions and grunting suggests increased inspiratory effort, so which may be due to airway obstruction. Periods of apnea that last longer than 15 seconds and are accompanied by bradycardia may be a sign of a cardiovascular or central nervous system disease. Next assessment procedure is percussing the chest. So during the percussion of the lungs, tone elicited is included. So normal findings, hyperresonance is the normal tone elicited in the infants because of thinness of the chest wall. So the abnormal findings, adult tone may indicate a mass fluid of consolidation. So the next assessment procedure, auscultate for breath sounds and adventitious sounds. If a newborn's lung sounds seem noisy, auscultate the upper nostrils. And the normal findings, breath sounds may seem louder and harsher in young children because of their thin chest walls. No adventitious sounds should be heard, although transmitted upper airway sounds may be heard on auscultation of thorax. So the abnormal findings, diminished breath sounds suggest respiratory disorders such as pneumonia or atelectasis. The sound stridor or the inspiratory wheeze is a high-pitched piercing sound that indicates a narrowing of the upper trachebronchial tree. So expiratory wheezes indicates narrowing in the lower tracheobronchial tree. So rhonchi and rales or the crackles may indicate a number of respiratory diseases such as pneumonia, bronchitis, or bronchiolitis. And the next is the assessment procedure in breast of the infant. So inspect and palpate breast and the shape, symmetry, color, tenderness, discharge, lesions, and masses are included. And the normal findings, newborns may have enlarged and engorged breast with a white liquid discharge resulting from the influence of maternal hormones. So this condition resolves spontaneous within days. The abnormal findings, palpable mass of the breast is abnormal. The newborn or infant may have extra nipples noted on the chest or abdomen called supernumeratory nipples. So the next assessment procedure is the inspecting and palpating the precordium. So it's in the heart. So the normal findings, the apical pulse is at fourth intercostal space until the age of 7 years when it drops to fifth. It is also left medicular line until age. So the abnormal findings, systolic heave may indicate right ventricular enlargement. Apical impulse that is not in proper location for age may indicate myopathy, or pneumothorax, or diaphragmatic hernia. And the next is the occultation of heart sounds. So an occultating heart sound, so you have to listen to the heart. So note that rate and rhythm of apical impulse, S1 or S2, extra heart sounds and murmurs. Keep in mind that sinus arrhythmia is normal and infant. So the normal findings and auscultation of heart sounds. Normal heart rates are cited in the previous vital signs. So innocent murmurs, which are common throughout childhood, are classified as systolic, short duration, no transmission to other areas, grade 3 or less, loudest and pulmonic area, low pitch, musical or grounding quality that varies intensity in relation to position. So respiration, activity, fever, and anemia. No other associated signs of heart disease should be found. And the abnormal findings can be observed is that murmurs that do not fit the criteria for innocent murmurs may indicate a disease or disorder. So extra heart sounds and variations in pulse rate and rhythm also suggest pathologic processes. So the next assessment procedure is the inspection, the shape of the abdomen. So the normal findings and inspectioning the abdomen is in infants the abdomen is prominent and supine position. So the abnormal findings that can be observed is that a scaphoid or boat shape sunken with prominent rib cage abdomen may result from malnutrition or dehydration, and distended abdomen may indicate pyloric stenosis. And the next assessment procedure is inspect the umbilicus. So note that color discharge evident herniation of the umbilicus is included. So umbilicus is pink with no discharge, odor, or redness or herniation. Cord should demonstrate 3 vessels, 2 arteries, and 1 vein. Remnant of cord should appear dry 24 to 48 hours after birth. And the abnormal findings that can be observed in inspectioning the umbilicus is that inflammation, discharge, and redness of umbilicus suggests as infection. So diastasis recti, separation of the abdominal muscles, is seen as a midline protrusion from the xiphoid of the umbilicus or pubis symphysis. So this condition is secondary to immature musculature or abdominal muscles and usually has little significance. So as the muscles is strengthened, the separation results on its own. And the other abnormal findings, a bulge of the umbilicus suggests an umbilical hernia, which may be seen in newborns. Many disappear by age of 1 year. So there's also a cultural considerations in the umbilical hernias. So in the inspectioning of umbilical. So umbilical hernias are seen more frequently in African American children, and abnormal insertion of discolored cord or 2 vessels cord could indicate genetic abnormalities. So however, these are also seen in newborns about abnormalities. So the next assessment procedure is that auscultation bowel sounds. So the normal findings can be observed. Normal bowel sounds occur every 10 to 30 seconds. They sound like clicks, gurgles, or growls. So the abnormal findings that can be observed is that marked peristaltic waves almost always indicate a pathologic process such as pyloric stenosis, and can be observed in abnormal findings. So the next assessment procedures, that palpation for masses and tenderness. So on this assessment is you have to palpate abdomen for softness or hardness. So the normal findings that can be observed is that abdomen is soft to palpation and without masses or tenderness. And the abnormal findings that can be seen is that a rigid abdomen is almost and always an emergent problem. So masses or tenderness warrants further investigation. So Hirschsprung's disease could also be considered, especially with a palpable suprapubic mass. So then next is palpate the liver. So liver is usually a palpable 1 to 2 centimeter below the right costal margin of your children. So the liver is hard to palpate in newborn. So the abnormal findings that can be observed is that an enlarged liver with a firm edge that is palpated more than 2 centimeter below the right costal margin usually indicates a pathologic process. So next is palpation of the spleen. So palpate the spleen the same as you would palpate for adults. So the normal findings, spleen tip may be palpable during inspiration. The spleen is difficult to palpate in the newborn. So the abnormal findings that can be observed is that enlarged spleen is usually indicative of a pathologic process. So next again, the palpation of kidneys. Palpate the kidneys the same as you would for adults also. So the tip of the right kidney may be palpable during expiration. Enlarged kidneys are usually indicative of a pathologic process. The next assessment procedure is that palpation of the bladder. So same as the adults also, you have to palpate the bladder as same as you palpate the adults. So bladder may be slightly palpable in infants and small children. So the abnormal findings that can be observed is that an enlarged bladder is usually due to urinary retention but may be due to a mass. And next is the assessment procedure in male genitalia. So inspect the penis and urinary meatus. So inspect the genitalia, observing size of age and any lesions. So the normal findings, penis is normal size for age and no lesions are seen. So diaper rash, however, is a common findings in infants. So the foreskin is retractable and are circumcised child. So urinary meatus is a tip of glans penis and has no discharge of redness. So penis may be appear small and large for gestational age boys because of overlapping skin folds. And for circumcised boys, the site is dry with minimal swelling and drainage. So the abnormal findings that can be observed is that an unretractable foreskin in child older than 3 months suggests phimosis. So paraphimosis is indicated when foreskin is tightened around the glans penis and in a retracted position. So hypospadiasis, this is the urinary meatus on the ventral surface of glans. And epispadiasis, this is the urinary meatus on dorsal surface of glans. And these are congenital disorders. So next is the inspection and palpation of scrotum and testes. So to rule out cryptorchidism, it is important to palpate for testes in the scrotum in infants. So scrotum is, in the normal findings, scrotum is free of lesions. Testes are palpable in scrotum, with the left testicle usually lower than the right. So testes are equal in size, smooth, mobile, and free of masses. If a testicle is missing from the scrotal sac, but the scrotal sac appears well developed. Suspect psychologic cryptorchidism. The testes has originally descended into the scrotum but has moved back up into the inguinal canal because of the cremasteric reflex and the small size of the testes. So you should be able to milk the testes down to the scrotum from in the inguinal canal. This normal condition subsides at puberty. So the abnormal findings that can be observed is that absent testicles and atrophic scrotum suggests true cryptorchidism. So this is the undescended testicle. So this suggests that the testicle never descended, and this condition occurs more frequently in preterm than term infants because testes descend at 8 months of gestation. It can lead to testicular atrophy and infertility and increases the risk for testicular cancer. So the next is the inspection and the palpation of the inguinal area for hernias. So the only normal findings that no inguinal hernias are present, and the abnormal findings is that a bulge in the inguinal area or palpation of a mass in the inguinal canal suggests an inguinal hernia. So indicate indirect inguinal hernias occur most frequently in children. So the next other assessment procedure for female genitalia is that in the labia majora, the labia minora, vaginal orifice, urinary meatus, and clitoris for the female genitalia. So the normal findings that can be observed is that labia majora and minora are pink and moist. So newborn's genitalia may appear prominent because of influence of maternal hormones. So bruises and swelling may be caused by breech vaginal delivery. So pseudomenstruation or the bloodstream discharge, smegma or the cheesy white discharge of the sebaceous gland, reddish orange pink thin urine or stains on diaphragm may also be normal due to uric acid crystals. So the abnormal findings that can be seen in the female genitalia is that enlarged clitoris in newborn combined with fusion of the posterior labia majora suggests ambiguous genitalia. So next is the assessment procedure of the anus and rectum. So inspect the anus. So the anus should be inspected in infants. Spread the buttocks with gloves hands, and patency of the anal opening, presence of any lesions and bruises and conditions, and color of perineal skin is included in inspecting the anus. So the normal findings is that the anal opening should be visible and moist. The perineal skin should be smooth and free of lesions, and perineal skin tags may be noted. Meconium is passed within 24 to 48 hours after birth. So the abnormal findings that can be observed is that imperforate anus, no anal opening should be referred. Pustules may indicate second any infections of diaper rash. So no passage of meconium stool could indicate no patency of anus or cystic fibrosis. And the next is the musculoskeletal. So assess arms, hands, feet, and legs. So in assessing the arms, hands, feet, and legs of the infants, so the symmetry, the shape, the movement, and the positioning of the feet and legs are included, and perform neurovascular assessment.